Good morning, everybody. Coming to you live from Cold Lake First Nations, June 29th, 21. Here to give you a quick COVID update. We're currently sitting at 0 cases, and we have some guests here today. So I'm going to introduce you guys to Dr. Parminder Tierra, Regional Director, Primary and Population Health, First Nations and Inuit Health Branch, Alberta Region. Department of Indigenous Services Canada, Government of Canada. Carissa Martin, Environmental Health Officer, FNIB, and Lillian Terzanski, Nursing Manager. So go ahead, Lillian.
Thank you, Kelsey. And thank all of you for joining us today, and I hope that you're keeping cool in this heat, and we'll maybe have a little brief discussion about that at the end of our wrap-up here. So this morning we have some invited guests that I've asked to come and talk to the community here about our vaccination rates here on reserve. I'm going to share with you where exactly we're at as of today and where we need to go. So I'm going to just basically give you incremental vaccination rates for each of these age groups. So our 75 to 79-year-olds, you guys have knocked it out of the park. You're sitting at about 70%. Same with our 70 to 74-year-olds. Thank you guys very much for showing up, and I hope to see more of you. That doesn't mean that we should stop. It just means that we've kind of reached that ideal point, but I would love to see more of you come in and get the jab. For the 65 to 69-year-olds, we're sitting at 67.2%. Our 60 to 64-year-olds, 63.8% have gotten their first doses. Our 55 to 59-year-olds, you're sitting at 61.2%. Our 50 to 54, you're sitting at 64.4%, and I'm a little blind. Our 45 to 49, unfortunately, you guys are sitting a little bit below that. We're sitting at 58.9%, so a little bit of work to do here. I'd love to see more of you in this age group show up. Our 40 to 44-year-olds, you're at 47.7%, and this is where things begin to tank a bit. So our 35 to 39-year-olds, you're sitting at 45.8% of you who have had your first doses. Our 30 to 34-year-olds, I am very concerned about you. You're sitting at 25.2% have only had their first dose. Our 25 to 29-year-olds, a little bit higher at 36.7%. Our 20 to 24-year-olds at 30.7%. Our 18 to 19-year-olds, you guys are doing good. I need a little bit more of you though, 36.7%. And our 15 to 17-year-olds, you're sitting at 29.4%. And finally, our little ones, 12 to 14, again, very low vaccination rate here, sitting at 26.3%. So I'm really concerned with those who are 40 and under. You guys are our most social groups. You enjoy the group gatherings, you enjoy getting together with friends, and this is why it's so important that we share this information with you so that you understand the risks. And so to speak to those risks, I've asked Dr. Parminder Tierra from Population Public Health Branch with Indigenous Services Canada and FNIB to come and speak to that. So Parminder, I'm going to turn the show over to you for a little bit to maybe talk about those low vaccination rates and the risks for the community.
Thank you, Lillian, and thank you, Councillor. I really appreciate kind of the opportunity to be here today. I really appreciate it, and thank you, Lillian, for kind of that really detailed breakdown of the rates. I think it's truly a testament to kind of your health team in being able to kind of keep track of the data and really have a strong understanding of kind of what's happening within the community. And that's important because we are wanting to make sure that we understand the amount of risk or vulnerability that might be within the community. And maybe what I mean by that is that, I appreciate that all of us have been super excited to hear that, across the province, we've hit 70% and just over 71% in terms of individuals receiving one dose of vaccine. And we're probably close to about 40% right now in terms of individuals receiving their second dose of vaccine. So that's good. And initially we set these targets of about 70%. Early on, as the modeling work had looked at, they kind of projected we needed to hit at least 70% to 80% to really make sure that we would be able to effectively protect each other, what we also kind of refer to as herd immunity, that we have enough people within the population so that if one of us became exposed to the virus, we really wouldn't see transmission further from person to person, right? That it would be fairly contained to that individual or anybody else around them that maybe was not immunized. And that's kind of a key piece. So this is something we use with all kinds of other vaccine preventable diseases, why we immunize. You know, we see here in Canada very few measles cases, and that's because we've done an excellent job in terms of immunizing people to make sure that they have protection on board. We don't see a lot of pertussis. If we do see this, these are usually in small kind of small pockets of the population, maybe where people are not protected. So either they don't have, you know, vaccines on board, or maybe, you know, vaccines are not 100%. There's a small percentage of people where they're just not able to launch that kind of immune response that's needed. So this is what we use. Early on data would show that we need to hit at least 70%, but I would encourage communities to actually get beyond that, because we know that, you know, the virus is changing, right? We've been hearing about more of the variants, more mutations that have arisen. And, you know, even the B117 virus was more transmissible than kind of the virus that we'd originally seen when the pandemic originated back in 2020 in kind of March, April. And now the Delta variant that people have heard about that was originated in India, we found to be even more transmissible than the B117 variant from the UK. And that means that, you know, the more transmissible a virus is, the more we actually need to have in terms of people being vaccinated or immunized, so that we have more protection and are better able to protect not only ourselves, but our families, our communities, so that we can protect each other. And I think that's probably the key piece. We as the FNIB MOHs, you know, we've seen that we're moving forward provincially towards 70%, which is great. What we're seeing though in First Nations communities is that overall we've had about 56,000 doses that have been administered across all communities within the region, and roughly about 51% of individuals over the age of 12 living on reserve have received at least one dose of vaccine, and roughly about 37% have received 2 doses of vaccine, which is really great. So we're extremely excited about that in terms of the tremendous work by, you know, members in the community, by the health teams to kind of get vaccines administered. But we're not quite there to that 70% target and beyond, right? As I mentioned, this is our best way to protect ourselves, because if we don't have that kind of higher 70 to 80% coverage rate, should there be an exposure and somebody does become exposed in the community, what happens is that we will see more transmission between people, and therefore we will see outbreaks. We do expect, even now, even though it's great news that, you know, I think yesterday they mentioned it was only 30 cases that had been identified across the province, we do expect to still see COVID cases. We will not eliminate COVID within the province. So moving forward into the summer and the fall, we still expect to see COVID activity. And predominantly the activity that we are seeing is mostly in the unimmunized. You know, I want to take a few minutes just to maybe talk about the vaccines themselves that are currently available in community. It's the Moderna and Pfizer vaccine. The Moderna is being used for those individuals that are over the age of 18, and the Pfizer for those 12 and really above, but predominantly focusing on the 12 to 17-year-olds. And both of these vaccines are safe, they're highly effective. Data from Alberta shows that after 1 dose of vaccine, so usually we look at 14 days after you've been administered the vaccine, because it takes about 14 days for you to develop immunity. We see that both vaccines are anywhere from about 73 to 82% effective at preventing symptomatic infection after 1 dose. And after 2 doses, that number rises, you know, 14 days after the 2nd dose, that number rises to just like over 91 to 93% in terms of vaccine effectiveness. We also know from our data here in Alberta, because they checked against the B117, which is kind of our, you know, most dominant kind of variant across the province. And, you know, that's a variant that Cold Lake has seen as well in terms of the coronavirus, and also the P1, which has not been seen as much in First Nations communities, but is, you know, circulating in the province, that our vaccines, even after 1 dose, are about 75% effective. And after 2 doses are kind of as well, again, in the low 90% coverage rates or percentage points in terms of protection against symptomatic infection. The vaccines are even more effective in terms of preventing against hospitalization and death. Data from Alberta shows that over 90% of those people, since we began the immunization program here in Alberta in January, over 90% of those individuals who are been hospitalized are individuals who have not received any vaccine. And sometimes even with one dose of vaccine, we know that you have partial immunity, but as I said, not as good as if you were into the 90% range. The one thing that I do want to flag for individuals is the idea about the Delta variant. So that's something that you would have heard in the news. That's the new variant of concern globally. It was originally identified in India. That variant is much more transmissible. And what we know from the United Kingdom or from Public Health England, their data shows that after one dose of vaccine, we don't kind of have the same coverage rates or effectiveness as we see against, the B117 or the P1 variants that are, more predominant here in Alberta. But we know we've already got about 700 cases of the Delta variant here in Alberta. After one dose, they've seen only 30% vaccine effectiveness, but it does jump up to 88% effectiveness with 2 doses. And we know that, the projection, not here just in Alberta, but across the country, is that the Delta variant will most likely become the dominant strain that we see across the country. So it's really imperative that people not just get their first dose of vaccine, but also their second dose of vaccine to make sure that we have really good protection against what is likely going to be the dominant strain within the province. And I think if I can leave just with one last detail in terms of how effective the vaccines are, both within First Nations data as well as kind of the provincial data, what we've seen is that those individuals who have had at least one dose of vaccine and 14 days afterwards, out of all of those people, so when you think about in Alberta, that we've got almost 70% of, those over the age of 12 immunized, and even in First Nations communities, over 50% of those living on reserve. Only in the Alberta population, only 0.5% of those individuals have actually gone on to develop any kind of either symptomatic or asymptomatic disease, like where they've tested positive for the disease. That's with just one dose. And with 2 doses, we've seen that it's actually less than 0.1%. In First Nations communities, that number is actually 0.08% out of all people that have been immunized with 2 doses of vaccine. So while we know that, if you've been immunized, there is a chance that you could get infected, I really want to stress amongst all of the people that have been immunized, we've seen extremely low numbers of individuals who have actually experienced disease. And so, Lillian, maybe I'll stop there and see if there's any questions that you might have or anything that I might have missed.
No, I'm really glad that you clarified that, Parminder, because I have had people, when we've had these phone calls of trying to get people in, really question the validity of the vaccine because, you still may get the virus, you may still transmit the virus, but I'm glad you put it into that perspective of that really low probability of that, and the fact that the vaccine is meant in a pandemic as a way through this pandemic, but also yes, you might still get the disease. However, those severe outcomes and hospitalizations are hugely impacted by this vaccine. And I think that's the point that we really want to get across. We recently had in our community 2 active cases, and unfortunately one of them was hospitalized. And so I really want to drive that home. We don't know why COVID picks and chooses to infect one person one way and another person another way, and what age groups they affect. We are all at risk, and this is why it's so important for us to get those vaccination rates up. And I want to thank you, Parminder, for coming on today and sharing that with us. What I'd like to do is I'm going to move on to our Environmental Health Officer, Carissa Martin. And Carissa, some of you might know her and have seen her in the community. She's worked with our community now for quite a while. And she goes out and she does home inspections and basically is our go-to person for information where we need it. And what I've asked Carissa to speak to today is to, I guess, put COVID in a little bit more perspective as to where we're at with the community, with our vaccination rates currently to date, when it comes to social gatherings and functions. So Carissa, I'm going to turn it over to you for a few minutes to speak to this. And again, welcome.
Thank you. Thanks, Lillian. Thanks for having me. Yeah, so I just wanted to talk a little bit about kind of the guidance for kind of events going forward, now that it's the summer, and just kind of what those recommendations are going to be, considering that we're not quite at that 70% vaccination rate. So at this stage, for any gatherings or events, we're really looking at following the stage 2 guidelines. So I just wanted to go over and hit some of those kind of important topics when it comes to the recommendations. I'm not going to hit all of them, but yeah, I just wanted to start with the stage 2 guidance for public outdoor gatherings. So public outdoor gatherings, they are allowed under stage 2 guidelines. And these public outdoor gatherings are, for example, like fairs, festivals, concerts, and these are allowed for up to a maximum of 150 attendees. Okay. And this doesn't include any staff or volunteers. They're not counted as part of the 150 attendant limit. Masks at these gatherings, these outdoor gatherings, attendees may choose to wear masks. However, it's highly recommended that they do wear a mask. And it's also recommended that any staff that do work these events, any volunteers, their names and their contact information are kept in order to facilitate any contact tracing efforts that that need to potentially be done. And also just information on any staff who do work these events, if they work closely together, keeping that information is really helpful when it comes to contact tracing. And so these events, they do have to be held in outdoor public places, so there can't be an indoor component to them. So we need to be able to monitor attendance and control flow. So the actual event area kind of needs to be defined with one entrance, one exit, barriers to kind of keep tabs on the attendance. And just one thing to keep in mind with these events, that the area has to be large enough to allow for the 2-meter physical distancing between households or individuals within these 150 attendees. So we just have to kind of keep that in mind, that physical distancing is still really important. And yeah, there just needs to be managed participant flow at the entrances and at the exits. Any concession stands or washrooms, we just have to make sure that people are keeping their distance from one another. And like I mentioned, there can't be any indoor components to the festival unless it's for like a washroom or tickets, medical or first aid. But otherwise, it has to be kept outdoors. I just wanted to mention a little thing about the attendance. So only 150 people are allowed to be attending the event. So stacking isn't allowed. So having multiple groups of 150 people attending at the same time, that's not allowed. That really increases the risk that someone could pick up the virus. And then also attendee turnover isn't allowed. So that's basically when within the 150 people, if some people leave and then it's replaced by another group of people, that's also not allowed as well, just because it increases basically the amount of people that attend that event. Yeah, and food service, if there's any questions regarding food, I'm happy to answer them. The main point is just controlling crowding and distance with food services. Performances are allowed at these events, but we just have to make sure that the performers are distancing before and after the event, and then also collecting the names of the performers as well is good, just in case we need to do some contact tracing. And yeah, so that's kind of the main points with outdoor gatherings. Is there any questions with outdoor gatherings?
So currently we're sitting at stage 2. Alberta is moving to stage 3 as of July 1st, I believe. What are your recommendations for the community at this point in time, Carissa? Like I do recognize, and I think we all recognize the fact that our vaccination rates are lower than the Alberta province. I do know that, you know, most of our staff are still trying to plan to make events very safe. Is that, I guess, the best way forward for us currently until we can boost those vaccination rates? Like I know, you know, all of us want to throw out these masks and throw open the doors and be able to talk again, you know, one-on-one. Yeah, and so we're, you know, I guess my greatest concern at this point in time is, of course, Treaty Days, which is July 12th to the 14th. Am I right, Daniel?
9th, 10th, and 11th.
Oh, sorry, 9th, 10th, and 11th. And so I know that the community was really looking forward to doing a 3-day event. Unfortunately, I don't believe that's going to work at this point. So I believe that they've got it down now to a 1-day event, and the planners have worked really hard at making this an enjoyable event, but also a very safe event. And so they have asked for input from yourself, as well as input from our health services department. And I hope that it turns into being a great day to enjoy Treaty Days and a great day to take in some of the festivities out there. But again, please, just to our general community members, please make it a safe event. Still follow some of these guidelines. Like we can knock this out of the park, guys. All I really need is over the next 2 days for you guys to come and show up and get your shots. We're ready, willing, and able, and it takes very little to turn the tide in our favor. If we look at the denominators in each of these age groups, you know, if 20 or 30 of you show up from these different age groups, we hit our target. So please, if you're sitting on the fence, give us a call, come on in. Today we're doing vaccination clinics from 1 until 4, just a walk-in vaccination clinic. And if for some reason those times don't work for you, give me a call. I will gladly stay later and wait for you, because I want you to get this protection as well. So I think with that, I'm going to wrap up a little bit. Do you have any questions, Kelsey?
Yeah. I'm a leader of community, and my job is to keep the community safe, you know. So, you know, coronavirus is still out there, so I recommend people get their shots, you know, if you haven't got them, because the virus is still out there. I don't want to see any people getting sick from this, well, you know. And Treaty Days is still a go. You know, it's going to be camping at your own risk, but restrictions are still put in place. You know, sanitize when you could, wear your mask, you know, and just try to be safe out there. Like I said, I don't want anybody else to get sick, and my colleagues too. So this is the reason why we're having this podcast. So,
Okay.
yeah, thank you. And maybe we'll talk about the vaccine lottery.
Yes, so one of the reasons I asked for these ladies to join us and giving you the information out there that you need in order to be safe, but I also want to announce that we have a vaccine lottery going for the next 2 days. So if you'll look at our Cold Lake First Nations website, you're going to see the age groups up there. Daniel, do you happen to have them handy? What we've done is we put together our own Cold Lake First Nations vaccine lottery. So those kids who are 12 to 19 years, I do believe, in that first age group, if you've received your first dose before June 30th, your name will be automatically entered into our draw. So if you've received your dose here at our First Nations, your names are automatically entered, okay? For those of you who are band members off reserve who may have received your first dose somewhere else, there is actually, we're not excluding you, there is an online application attached to the vaccine announcement at our website, and you can sign that form and send it in, and should your name be drawn, then you would just need to provide us proof of vaccination prior to midnight of June 30th. So those 12 to 19 years of age, the prize will be, first prize is a Nintendo Switch, and the second prize is a Nintendo Lite. The second age group was 20 to 30, what, Daniel? 20 to 34 or 20 to 35, I believe. He's going to hold it up here for me so I have it right in front of me. Here we go. So our second age group is 20 to 34 years of age, and the first prize is an iPhone 11, I believe, and the second prize is a 64 gigabyte iPad. For our 35 to 49-year-olds, first prize is now changing to cash prizes. So you guys are going to get $750 for coming in and getting your jab if your name is drawn. And the second prize will be $500 in that age category. And then so from 35 to 49, it's $750 and $550 first and second prize. And then the same with the 50 to 64-year-olds and the 65-plus-year-olds. So you guys have a really good chance of winning some money to enjoy your summer. So please come on out and get your jab. I can't, tell you enough how much I want to see you come in and how much I want this community to get to 70, get to 80, get to 90%. Let's open this community up. And let's enjoy one another company again and being able to do it safely. I want to look forward to full-on programming come this fall. We've all missed our people, so please come in and get your jab today. And if you have any questions about the vaccine lottery, give our office a call, 780-594-2473, if you have any questions at all. So again, today, walk-in clinic between 1 and 4, and tomorrow we are doing clinic all day long from 10 until 4 o'clock. Those are your chances to get your first doses and get in on this vaccine lottery. And don't forget, you could also get into the Alberta vaccine lottery for that $1 million draw. There's 2 more $1 million draws coming up. I believe the first one has closed. But there's 2 more $1 million draws, as well as draws for some fantastic trips and other prizes out there. So with that, I'm going to wrap up. Carissa, Parminder, thank you guys so much for joining us and providing us some information. Kelsey, thank you for being here from leadership and helping us to support, what we're doing here at Health and trying to get our community vaccinated. It is truly appreciated. So with that, thank you very much.
Thank you, ladies, for coming out, and if anybody has any questions, they can contact Lillian at the health center. So with us wrapping up, if you don't know, now you know. Have a good day and enjoy the weather and keep safe.
Thank you.
Awesome.
Bye-bye.